Potentia Wealth brings you the Power of Wealthness podcast.
There are few decisions in life that carry more emotional weight than determining how and where a loved one should live as they age. Families often find themselves navigating unfamiliar territory. You're balancing safety and independence, financial realities and medical needs, and the deep desire to honor a parent's dignity as they age. The process can feel overwhelming, urgent, and even at times frightening. Our guest today is Keri Landrum. She has spent years helping families make these incredibly important decisions. As an elder care living consultant in the San Jose area, she guides clients and their adult children through a complex landscape of in-home care, assisted living, memory care, and other senior living environments. Her role is unique. She serves as an advocate and educator, a trusted guide during one of life's most challenging transitions. Today, we'll explore how families can approach these decisions properly, what mistakes to avoid, and how planning ahead can bring clarity, confidence, and empowerment. Keri, welcome to the Power of Wealthness.
Thank you, Kevin. It's nice to be here.
It's an important role that you play. How did you get started in this industry?
Well, I started pretty young. When I was in early high school years, I noticed there was a lack of social programming at the church I attended for the seniors. They had all these other programs for the kids, for the young adults, for the my people my parents' age. And so I went home one day and just said, "Mom, there's several ladies who've lost their husbands at church, and they don't seem to have any social activities." And so then I started a Monday drop-in group where I would play Scrabble or Boggle, and we'd do a little devotional, and I would make lunch and bake some cookies, and we would just spend about 3 hours together. And about 6 ladies would come, and we had a great time. So from that, as I went on to college, I decided to finish my degree and go back and get a master's degree in gerontology. So the study of aging has just been very near and dear to my heart for many, many years. My grandparents lived next door. So I had, a very obvious example of how to assist and what needs might come up as you age. And so I kind of stayed on my path. It started when I was young, and I continued on that path. I did an internship for Hospice of the Valley, as well as the long-term care ombudsman program. And the ombudsman program is an advocate, and so they serve as advocates for seniors in long-term care communities and facilities. And then I also worked in senior housing, low-cost senior housing HUD facilities in Campbell and Santa Clara. And then I worked in skilled nursing facility. So that was for about 6.5 years, a local skilled nursing facility. And I loved, that role. And that's kind of what was the segue of me eventually starting Next Steps for Seniors, where I could individually help families on their path of, you get into a situation, it's like, this is getting challenging. What's the next step?
So that's, first of all, it's been a lifetime journey for you then. It started as in high school and right up through today. And helping seniors find a community and a place is what you've always done then, and all of your life experiences leading up to this.
Yes. Yeah. I feel very, fortunate. Not everybody feels a calling to do something, and mine started young, and I'm very happy that I've been able to stay on that path.
What is it that triggers families to reach out to you? What is it that causes that to happen?
Typically, there's an event. So lots of times I get phone calls when a loved one has fallen and they're either in the emergency room or another medical issue. It doesn't have to be a fall, but there's some type of event where somebody is in either the emergency room or has been admitted to the hospital or is now at a skilled nursing rehab. So the family's realizing wow, things really changed because of this event. And what is the next step? Because maybe going home isn't as feasible. We thought it would be, but now it's not. Ideally, my goal is to help everybody get home, but safely. So sometimes when you're leaving, whatever, after an event, be it you're still at home or you're in a hospital or rehab situation, I go out. If a family calls me, I get the information over the phone, and then I want to go out and meet the person that needs help, because what I tell everybody is like, okay, well, now I have this piece of paper that tells me a little bit about your mom, dad, or loved one, but that's not a person, it's a piece of paper. So I want to go out and meet them personally, because I go in and out of all of the various communities that are serving seniors, and they each have a different vibe. And just because they might fall under the same licensure doesn't mean they provide the same services. Some, some places have a memory care within their community. Some do not. Some places can manage giving injections for someone who's diabetic. Many cannot. If people need help with transferring, yes, we can do that, but only if it's one person. If you need a two-person assist, or what's called a Hoyer lift, which is a device to help save back injuries for staff, some communities don't do that. They don't want the liability. Their staff isn't trained for that level of care. So when I go out and I meet somebody in person, I get a sense for where they are now, what the goal is for as far as rehab, but also where might they be in 6 months or a year.
So studies show that seniors who stay connected in a community and are active, they live longer, more prosperous lives, a higher quality of life. So what are some of the common misconceptions that prevent people from making that decision earlier?
Well, I honestly don't encourage people to make that choice earlier unless you're really socially isolated and you're kind of craving that sense of community. So, kind of the old saying goes, or song goes, people who need people are the luckiest people. I'm a people person, so I think being around people is wonderful. Not everybody feels that way. Some people are actually more content with just as needed social interaction. So you have to weigh the personality of each individual. The benefits, for somebody who's really craving more social interaction, I think, obviously socially, you can engage in conversation. So maybe your mind will stay sharper. You won't just focus on your own health issues or the fact that you're aging. You can, meet other people and talk to them. But also for nutrition, I think people tend to maybe eat more if somebody else is eating with them. And that's a very important part of aging. And just some people really benefit from being around, group activities, and maybe even learning a new game or going to the exercise class. A lot of people hesitate to do it on their own. They know they should. Their doctor told them they should. But when you sit in that group exercise class, then all of a sudden you feel like you're part of the group and you want to participate.
I know for my mother, she was at a place where she wasn't able to get around, wasn't able to drive. She couldn't participate in the church activities as much as she wanted. She was dependent on other people to pick her up. And then those, they weren't always around to do that for her. And so, but she always thought of the retirement home as a place where people go to die.
Right. That's why I encourage, so when somebody meets with me, and if that level of care, assisted living or memory care, is what seems to be the most practical approach to their situation, then I discuss with the families which places might be the best fit. And that would be, because of the location, their care needs, the cost. And then I go with them. I make the appointment. I go with the family to take the tour. And if the potential resident, the loved one, is able to go, I encourage that as well. Because lots of times when you walk in, they realize like, oh, this is not what I was imagining. I was thinking of an old folks home. This really isn't. This looks more like a hotel, which is most assisted living models do try to, make the environment look aesthetically pleasing. So, it doesn't feel depressing, and it doesn't feel like what many would picture as, the old folks home or a nursing home. And, a lot of times the communities encourage people to stay for a meal, come for lunch, that I think usually helps people realize like, oh, yeah, this isn't too bad.
Yeah. For my mother, she got to participate in activities that she really enjoyed. She made some very good friends. They were started in independent living, and eventually she moved into the memory care. So she had that continuity of care, and she actually had friends that moved with her in the facility. The same thing with her husband. So it was a really good experience for her. I saw her, like you said, eating better. I remember one time she ended up in the hospital because she was dehydrated. And so she says, well, I don't understand. I'm drinking all the time. I said, well, what are you drinking? And it was coffee and Mountain Dew.
Oh.
So, getting her into a facility and having someone who provided food to her. I mean, they had a menu. It was like a restaurant there when we could visit anytime. And you're right. They were very welcoming to the family to come in and visit.
Right. So many assisted living communities do in their dining room, it is restaurant style. They've really moved away from, like the buffet lines that used to be, maybe a salad bar and things like that. Very few, if any, now offer that. And it's restaurant style. You order off a menu. If you don't want what the special is, you have other options. And a lot of, if it's kind of a standard assisted living, they have kitchenettes. They might not have, the oven and all of that to bake, but they do have, a small refrigerator, maybe a microwave and a sink. And so all the meals are provided, but they can also have different snacks that they like. It's not as bad as people think if they take a look.
So would you say that that's the thing that has changed over time in the elder care industry, is that it's, they've given more options and made it more community oriented?
Yes, many have. I think aesthetically, they've definitely made a transition like that more desirable. What happens lots of times is that I might be touring the adult children and they're listening to all the services available. Like, oh, we get, housekeeping once a week. They'll change your sheets and wash, your towels. You just have to have the sheets. You have to have an extra set available. They'll do your personal laundry. But if you want, you can do it yourself. But that's part of the service, the meals, the activities, the exercise. And, movie every night. And the adult kids are like, well, maybe we could just get someone to take care of mom at home and we'll move in. And just really choosing, making sure that the community you choose really does have the ability to meet your loved one's needs.
You mentioned that you don't recommend that people move into independent living or assisted living too soon. So how does a caregiver know when is the right time? What are some of the signs?
Well, sometimes if you need more than one person at home to meet the needs, if it's a two-person transfer, so every time somebody has to get up out of a chair or out of bed, if you need two people, that gets really expensive unless it's family members that are there. So I'd say that's, one of the reasons. Cost of in-home care. If you just need like 4 hours a day of somebody coming in, then I think, if you're able to stay in your own home and get 4 hours a day where someone maybe helps you with the shower, helps make a meal for you, make sure you get your medications on time. But, that maybe you live with an adult child, so they get home from work eventually, but you're still cognitively okay. So you're safe in the home. You could call if you needed help. But if you're not able to call for help or, get to and from a bathroom independently. A lot of people would, 4 hours a day isn't really enough because there are 24 hours in the day and you don't know at what moment in time you're going to actually need that assistance. So in reality, you don't need more than 4 hours a day, but you need that spread over time. And there's no one that's going to be available to come, every hour for 10 minutes to check on you.
Exactly. And so this starts at being taken care of by people you live with. This is your family that's taking care of you when you need assistance. And then it's bringing professionals in to assist with that. And then when it takes more than one person or more than, say, 4 hours a day, that would be the trigger to start looking for another option?
That's like, a typical scenario for what I do. But like when I go in and do assessments, I try to see, what's going on. There was one family years ago. I did the assessment, and afterwards I said, well, I wrote down like her daily routine, and she was cognitively, she was okay. And that's a big deciding factor, I think. Are they cognitively okay to make safe and logical decisions? And if they're able to do that and they want to stay home, then I think even if you feel a little bit like, Mom, I don't think it's safe, allowing them some autonomy, I believe, is very important because, there's a lot of what ifs no matter where you are. But I think, the person that I was, doing the assessment on, after I went through everything, I told the family, I said, well, I think she's okay to stay home for a while, but you really need to have somebody here, on Thursday afternoon and on Friday morning, be it a friend or a neighbor or somebody that's hired. And they're like, why? I said, well, it's garbage day. And then, so she, the last time she fell, which makes her nervous, was when she was trying to get the garbage cans out. So we need to make sure that somebody is here on garbage day to get the garbage out, very important to her, and someone to bring the cans in. She doesn't like the can staying out on the street. But everything else between what you're doing and what the neighbors are doing, and it's all working out except for that. And so she actually stayed in her home another 3 years, and they stayed in touch with me. And I went out to do a couple more assessments. And then, and then finally I said, yeah, no, I think it's time now. She needs more care than that. And so it worked out great.
Yeah. So what I'm hearing is this is not you go out, make a recommendation, they go into a facility. This is a journey. I mean, you're actually meeting with these people a couple of times over a number of years and determining how to allow them independence and to be able to stay at home safely for the most part.
Exactly. And, sometimes it's just nice to have a third party come in versus family because, the family might see it differently, but also the individual, they might not always. They might listen to me more than they would their children.
Yeah. There's a lot of resistance in losing that independence, even having somebody take the garbage out for you or bring the cans back in. So when you're dealing with these issues, who are you working with and how are you resolving that resistance?
I'm usually working with the family. And when I do go in to meet with somebody, especially if making a move is what I recommend, I just look for little red flags, and there's so many areas of concern. But I like to work with either a family member or the power of attorney. I never want to just go in there and they have nobody and I'm like, oh, you should move to this place, because that doesn't feel right to me. I want to explain and make sure somebody's on board where I'm not just showing up and moving elderly people to, away from their homes.
And when you do help them make that move, there are different levels of care. Can you help us understand the difference between those different levels and what that looks like?
Yes. So the highest or lowest level of care would be independent living, and that's where you have your own apartment behind a closed door. And if it's truly independent living, then they have a lot of freedoms. You come and go as you please. It's your apartment, your home, and you might have some housekeeping services if you want them. And there's a dining room and some transportation and planned activities, but there's a lot of autonomy. Somebody isn't constantly coming in, to check on you, but usually they might have, if it's a true independent for seniors community, you check in each morning. Either you check in at the front desk or you make a phone call. If you don't do that, typically they have somebody who's going to follow up and maybe give you a call. If you don't answer that call, they might come knocking on your door and also let your family know or your loved one know that they didn't get a hold of you, and then go from there.
Yeah, and that's where my mother and her husband started. They were very independent. While they had the restaurant there that they could take advantage of, they had their own vehicle. So they would drive out, they would go to the park, they would go on days out. And it truly was independent for them, just having someone around to watch them on a daily basis. Right.
A sense of security too. That is not a typical client for me. So most of the people that reach out to me, actually, I work with a lot of individuals with a dementia diagnosis or other cognitive impairment related to stroke or Parkinson's. The next level, the assisted living, can help with a lot of those things. Medication management is a big factor. And that's one of the things that in assisted living, I encourage all of my clients to utilize that service. You do pay for it. So assisted living will have one price for the apartment each month that includes, you don't have to pay for your electricity and gas and water and all that. That's all included in your monthly rent. But then all of the additional services, if you need help with bathing, you can have assistance from set up and standby to full on. We're going to help you into the shower. We're going to help, scrub your back, make sure you get everything clean, help you out safely, make sure you're dressed. So bathing services can be anywhere from very minimal, even just a reminder, because some people they have cognitive impairment might think, oh no, I already took my shower. And it's like, no, you haven't. But so that would just be cueing and reminding to, hands-on or even two people assisting. Other services that are available are transfer services, like getting up and down from chairs and beds and things like that. A lot of people do experience incontinence as they age, and that can be challenging to manage on your own, especially if there's cognitive impairment, because you may not realize that you need assistance. And then hygienically, you want to make sure you keep your body clean so you don't have other infections. Assisted living services also include, maybe getting up and dressed for the morning, getting ready for bed at night, setting up your toothbrush and toothpaste. My mom, as she had a dementia diagnosis and as her disease progressed, she'd been doing really well, fairly independently. And I went in, I was there with her one night and she was getting ready for bed and she took Neosporin and put it on her toothbrush. And I was like, oh, wow, that's, so I took it off, and I got the toothpaste out. And so then her nightly routine was that she was getting ready independently, but then I added nighttime routine and removed Neosporin. In her mind, it was a tube, looked like toothpaste.
Right.
Therefore, there was a lot of logic still there, but some of the understanding was starting to fade.
That's the type of care that makes a difference. I mean, for my mother, she had medications that needed to be given, some of them 3 times a day, some twice, some once. So having somebody come in for 4 hours doesn't solve that problem.
Right.
Because you have to have someone there 3 times during the day, morning, afternoon, and evening. So in an assisted living, they had some additional care that would come up and provide her, at an extra cost, that medication to make sure that she took it when she was supposed to.
Yes. And my mom was able to stay out of a memory care. I took care of her at home, hired some caregivers part-time and things like that. Then I would have her stay at my house on the weekends. Then it got to the point like, she needs a little more care and supervision. So she moved in with me and that went well for a while. And then she was up all night. And so it got to the point where, okay, I cannot function on 2 hours of sleep. I need to still be, an attentive daughter and a mom and a wife. And that became more than I could handle, which happens to a lot of my clients with their own scenario, not exactly what I described, but there's just too much going on. There's other things in life and you can't stay awake 24 hours a day.
Well, and that's for the children, but also for a spouse. Because that then becomes their life, taking care of their spouse.
Yes.
And as they get older, they could become injured or hurt or even needing respite care from that.
Right. I was with somebody yesterday, the couple's in their early 90s and he's doing great and she's physically doing great, but she definitely has a dementia diagnosis. And sometimes she has a good night and sometimes she has a bad night. Well, she had a couple of bad nights. You're in your 90s and you're up all night, but you're the main caregiver. That's not safe for either of them at that point. So now they're inquiring about what the next steps might be. And I was able to meet with both of them and help determine a couple of options for next steps. So we're starting to explore those next week. But the son is involved and other family members. So just really knowing what the specific needs are and with medication management, it's true. You can't, if you hire somebody for 4 hours a day, well, who's going to give the 8 p.m. if the caregiver leaves at 4? Who's going to, and are they going to take 1 or 2 or not take them at all? When the kids come, and sometimes just having a pill dispenser can solve that. So, yeah, I mean, some of the things I do to have people, not feel like they need to move.
Yeah, to remain independent or at home.
I sit down and okay, what's a typical day? Tell me about what you like to do. And their level of mobility. If they can't get up and down from a chair, to and from a bathroom, no, they should not be home alone, period. That's not safe. But yeah, look at all those factors. But there are some things that can help keep people at home longer. The part-time assistance from an in-home care agency, and there's numerous ones out there. There's some that I've worked with for years that I'm really happy with, but it's about the person that shows up, not necessarily, the name of the business. There are pill dispensers that they look like one of those old bread machines, but you can fill it up for a week or a month and it beeps and the pills drop into a cup. Maybe that's all somebody needs. Maybe they just need help with showers. Maybe they have a dementia diagnosis, and the children or the caregiver or the spouse is exhausted and needs some time to themselves. There are activity centers specifically designed for seniors with cognitive impairment, and there's senior centers for people without cognitive impairment as well. But in the Santa Clara County, there are several Live Oak programs. There, Hearts and Minds in San Jose is a phenomenal program. It's in Saratoga, their community center has a senior program that's wonderful. You just need to, if somebody has a dementia diagnosis and that's why they're going, you need to make sure it's a program that's well aware of the disease, and you don't want somebody walking out the front door. There has to be safety.
And that's where your guidance is so important, because you understand those levels and you understand what facilities would be appropriate based on the loved one's need.
Right. Yeah. So once if they participate in an activity program, and if I recommend that, and that's what somebody does and they're doing well, but they still can't, the loved ones, people at home still can't meet the care needs, then I can go reassess at the activity center, senior center, and see how they're interacting with others. And if that's working really well, or if that's agitating them, if that group environment is, triggering them to have other behaviors, then I'm going to look for a smaller atmosphere. So you're kind of saying what other programs are available. So we started off with independent living, which is just as it says, independent with some oversight and activities and a sense of community. Then there's assisted living, where you can get help with what are called ADLs, activities of daily living: bathing, dressing, grooming, meals, medication management, getting from point A to point B. So you can have a caregiver help you get up in the morning and take you in your wheelchair, or walk with you with your walker, or even walk with you independently to the dining room to get your day started. Then they come back and they might escort you to the exercise program. From the exercise program, you might say, or the caregiver knows, now I know you like to go rest for an hour or so before lunch. Come back and bring you back down to the dining room at lunch. Maybe another activity, bring you back to the dining room for dinner. Then you don't have to, remember when and where to go, but also you get to and from safely.
And then the next level beyond that?
There are higher level assisted livings. So they all have the same licensure, but because of what I do, and I go in and out, I know which communities are able to handle higher levels of care. And then if cognition is, if there's a dementia diagnosis, then sometimes memory care is a better choice at some point, because the staffing there already assumes they're going to need to anticipate care needs, instead of somebody being able to say, oh, excuse me, I have to use the restroom, or gosh, I'm really hungry. They will keep an eye on you, anticipate your care needs, keep general track of how much you're eating and having fluids. They will, in the middle of the day, between all the meals and before dinner, offer you a little snack, fresh fruit or a cookie. Sometimes it's something healthy. Sometimes it's not as healthy. but also they really push hydration because that's a big thing that a lot of people kind of forget.
Yep. Like my mother.
Yes, mine as well.
So when I'm working with clients and we are doing their financial planning and they say, well, I'd like to have more money available while I can have a good quality of life and do my traveling and then I don't need as much money in my senior years. And I said, well, let's time out for a minute. So talk to me a little bit about what it costs for these level of care and how that's paid for.
The cost has gone up, as you can imagine, as everything has. So, I'd say this industry, definitely the prices have increased significantly. But it's not an easy job. So average price in this area, I'd say $10,000. You can find it for less. There are some places, another area I didn't cover was board and care homes. Board and care homes are private homes licensed by the state of California. They have to go through all the same training and follow the same regulations as assisted living, and they actually have the same licensure. And so their accountability is exactly the same as assisted living. But sometimes you can find, some nice board and care homes that are a little bit less money. Medicare does not pay anything. Medicare doesn't pay 1 penny of long-term care. Medicare will pay when you're in a skilled nursing facility for rehab purposes, but that's a really short, specific period of time, anywhere from a few days up to 100 days. But after that, and usually it's about 3 weeks is what Medicare covers. But that can fluctuate depending on what you're there for the rehab portion. But yeah, assisted living and memory care memory care is more expensive than assisted living typically.
So when you said $10,000, you're talking about $10,000 a month for a independent living facility or an assisted living facility?
I'd say that's kind of an average if you need some assistance.
Yeah.
Like an average 1-bedroom apartment in this area, you're looking in the probably $7,000 a month range. And I say range because sometimes the apartment might be on a special and you can get it for $59.95, or, they have, when census is low, they might, as all things in life, supply and demand. Yeah. But there might be, an incentive offered, or if you sign today, you'll get the 3rd month free, or things like that. But when I say that the $10,000, that's including some care. I'm assuming somebody moving is going to need some care. And like, if you're listening to this right now, you're like, $10,000, we can't do that. There are other options, so I wouldn't not call somebody if that was too much.
And this is where your guidance provides that balance between what you can afford and what the person needs.
Right. And paying more, like the fanciest places, don't necessarily offer the best care. And I'm not saying that they don't offer great care, but it may or may not be the right place for your loved one. But that's where I feel like my visits, I really value that personal one-on-one time with anybody who's considering assisted living or memory care, because each care community, be it like the 6-bed private board and care homes up to the really large places and the memory care, they all have like a different feel. And if it's a community that's been around for a long time, you might walk in and, definitely like a broad range of functionality in those residents. You might see a lot of people in wheelchairs and unable to communicate and interact as much, but maybe they've been there. That community's been open, so those individuals have aged in place. Whereas a brand new community might have a more vibrant vibe to it because everyone's just coming in. And so their activity program might be a little bit more robust and the residents participate more because they're capable.
How are you paid for the work that you do?
So that's a good question. And I do try to let everybody know because, they're like, wait, you're not charging me? So I do not charge families at all. I will stay involved as long as they need me. I'll be an advocate. But the way I am paid is one of my clients moves into assisted living, a board and care, or a memory care, after they've been there for 30 days, that community will pay me a one-time referral fee. What I do is I do the initial assessment, any follow-up, or as many assessments as they need. Like I said, some people I will go visit once a year or once every 6 months for several years, and maybe they eventually need placement outside the home. But I'm always really happy if they don't too, because it's like, yay, you got to stay home, and that's what you wanted. But I will, after one of my clients moves in, I go and I make at least one follow-up visit, making sure that everything kind of got set up.
It's the right fit for them.
Yes, and that's how I gather a lot of my information too. Like, okay, I knew what Mr. Jones needed. I referred to a place that I thought was going to meet all of his needs, and I go, and if something's not going right, I ask the family, like, this is what I noticed. Are you okay with me talking to management? Because, this other thing was supposed to be done, and I don't think it's happened yet. Or they're taking him to and from the meals, but he told me he hasn't gone to any activities. So I'd like to see if maybe we could start with one activity. Are you okay with me talking to them about making sure he gets to exercise each morning?
So it's difficult for the senior to lose their independence. Do you also see conflict within the families determining whether their parent should be put in a facility or not put in a facility, or what level of care they should or should not be receiving? And how do you resolve that?
I've dealt with that many, many, many times. And yeah, there could be differing opinions within a family. And I just do my very best at explaining, what the basic care needs are, and kind of taking the emotion out of it and saying, writing it down for family members sometimes, and also the individual, and saying, these are your care needs, because sometimes somebody will be in skilled nursing after rehab and say, well, no, I'm going home. I'm going home. I can do this. It's like, well, have you walked to and from the bathroom yet on your own? No, but I will be able to at home. Okay, tell me what that looks like. Can you show us how you get up out of the wheelchair? Can you demonstrate to your son or daughter that you can do that? So lots of times I'm working with families saying, you know what, and the individual, you're doing great. You've improved so much from your emergency room visit and your hospital stay and your rehab stay, but you're not quite ready to go home. It's a stepping stone process. So step by step. So I never say, oh no, here's the place I think you should go to, and that's just where you're going to stay. That's not my approach. I say this is a stepping stone process, and for your next step, you're going to, we think it's a good idea if you go here, and they can still help you as you continue to rehab and get stronger. And once you can do this, and sadly, lots of times it does revolve around using the bathroom. Once you can do that independently, if you could do that independently, then you can probably get to your refrigerator and take maybe a prepared meal out. And, so making sure that their basic needs are met. You can't have somebody stay home if they cannot meet their own basic needs.
When is the best time for families to start planning for that care?
So I think talking about it is always a good idea, but it is hard to plan because, kind of a low percentage actually of seniors ever really need assisted living. You might need it short term, if you have a hip replacement or, another medical issue. But even though we see all these assisted living communities and it's talked about, not everybody needs it. It's a fairly small percentage in the whole scheme of things. But sometimes just taking a look, taking a tour, and knowing what's out there. Like if you don't have a lot of family and or they all live out of state, but you want to make sure you stay where you are, that's when like the communities that offer what's called a continuing care retirement community, where they have independent, assisted, memory care, and a healthcare skilled nursing facility on the same property. In this area in Santa Clara County, the ones that are the common ones are Terraces of Los Gatos and Terraces of Los Altos, the Forum, Saratoga Retirement Community, Lincoln Glen Manor in Willow Glen. I'm probably forgetting a few, but that's just off the top of my head. The V in Palo Alto. Those are ones that have everything under one roof. And those can be really valuable, but also they may not be appropriate for somebody who actually needs care.
Yeah.
Because different options might make more sense.
And once they're in, let's say, an independent living facility, if it's not a continuing of care facility, do you go back in and reevaluate them again to move to another facility?
Absolutely.
Yeah. What does a successful transition look like for you?
Well, my goal is to get it right the first time. So that's why I like to go really talk about, I'm not a nurse or a doctor, but I do have a lot of, background. I used to do assessments at the hospitals for people going into skilled nursing for rehab. So that, that was good. So just years of doing this type of work. But I try to predict where somebody might be. I mean, if I have a man who's, 6'2", 200 something pounds, and he has Parkinson's, I'm not going to recommend that he move to independent living. I'm going to know that at some point he might need help transferring, and that at some point it's going to be a 2-person transfer. So I would tell the family, I know this place is really nice, and if you want him to stay there for a while, but if his care needs exceed what they can do, you will need a second move. So I try to make sure families are very aware of what the pros and cons are of each community. And I really like to get it right the first time. So once people understand what, the benefits, but also what the limitations are of each community, it makes more sense to them.
Yeah. I can say from my personal experience in working with my clients that you've had a significant impact on families' lives in helping them prepare mentally and physically for transitions for their family members, that you have helped them find the right fits for them so that they were able to live safely and happily and fulfilled lives as they journey through that last part of their life. It's made a significant impact, and thank you for doing that.
Well, thank you. I always appreciate the referrals. All of my clients pretty much find me by word of mouth. So if you're looking for me online, it's not.
They can find you through us.
Yes, and thank you. But I have spent. I'm more than willing to spend a lot of time with each person as much as they need. And I love being an ongoing advocate and resource for people, because a lot of people don't know how to navigate this. And there aren't too many people that just pick up the phone. It's a lot of, AI support. And that's not me at all. If you call, you're going to get me, nobody else. There's nobody that works for me or with me at this point, but I have a lot of resources in the community. Always, always happy to take the phone call. I'm not only looking for, where's my next placement? And so, I do appreciate making money on my placements. That helps with life, as we all need a source of income, but it's truly not what motivates me.
No, it's an altruistic drive. You're out there to be in service.
Yes. But I never want to mislead somebody too. Like when you ask, how do I get paid? I do get paid by the communities, but I'm willing to continue to be there for the individuals and the families, because it's an ongoing process.
Good. Well, thank you for that. And thank you for joining us here on our podcast.
Thank you for having me, Kevin. I appreciate it.
Keri, thank you for sharing your expertise and your compassion with our listeners today. Conversations like this remind us that thoughtful planning and the right guidance can transform what feels like an overwhelming life transition into a process grounded in clarity, dignity, and care. If today's conversation has helped you better understand the options available for yourself or for a loved one, we invite you to like, subscribe, and share this podcast with someone who may benefit from hearing it. And as always, remember to be proactive, be prepared, and look out for one another. Until next time, be the power of wellness.
Thank you for listening to the Power of Wellness podcast. Click the follow button to be notified when new episodes become available. Visit our website at potentiawealth.com or give us a call at 408-288-7886. The information covered and posted represents the views and opinions of the guest and does not necessarily represent the views or opinions of Potentia Wealth or Potentia RIA. The content has been made available for informational and educational purposes only. The content is not intended to be a substitute for professional investing advice. Always seek the advice of your financial advisor or other qualified financial service provider with any questions you may have regarding your investment planning. Investment advice offered through Potentia RIA LLC, a registered investment advisor.